Today we'll discuss why morphine is contraindicated in head injury. Why morphine is contraindicated in head injury. We all know morphine is a opioid analgesic, and when this morphine is given as a opioid analgesic in head injury, what will happen? We know that morphine will produce meiosis, pinpoint pupil, or it may cause vomiting, mental clouding, and these meiosis, vomiting, mental clouding, these are the important signs and symptoms in assessment of clinical course of patient with head injury. If you want to assess the clinical course of patient with head injury, you have to look for the meiosis, vomiting and mental clouding, right? And this morphine will produce all these symptoms, so that means morphine will interfere with assessment and prognosis of patient by producing all these symptoms, by producing meiosis, vomiting and mental clouding. Now in head injury patient, there is already a respiratory depression. In head injury patient, there is already respiratory depression, and morphine aggravates the respiratory depression in patients of head injury. It is already there, and this morphine will aggravate respiratory depression in patients of head injury. Now, how morphine causes marked respiratory depression? It causes respiratory depression by directly depressing the respiratory center which is present in the brainstem. Morphine causes respiratory depression by directly depressing the respiratory center which is present in the brainstem. Now, because of that, there is a less removal of CO2. Why less removal of CO2? Because there is a respiratory depression. Directly depresses the respiratory center in the brainstem. That's why less removal of CO2. If there is a less removal of CO2, that means this CO2 will increase in the blood. There is increased concentration of CO2 or carbon dioxide in the blood, and there is a formation of carbonic acid, CO2 and H2O, which is present in the blood. CO2 and H2O, which is present in the blood or in the body, it will produce carbonic acid, H2CO3, and this H2CO3, because of production of H2CO3, there is a chance of metabolic acidosis, and because of this metabolic acidosis, cerebral vessels get dilated or cerebral vasodilatation occurs, and cerebral vasodilatation may lead to increased cerebral blood flow, and that may lead to increased intracranial tension or intracranial pressure. And that's why morphine is contraindicated in the head injury, because it increases the intracranial tension or intracranial pressure. Why there is increase in the intracranial pressure or tension? Because there is increase in the cerebral blood flow. Now, why there is increase in the cerebral blood flow? Because cerebral vessels will get dilated, or there is a cerebral vasodilatation. Cerebral vasodilatation is because of metabolic acidosis. Now, why there is a metabolic acidosis? Because there is a formation of carbonic acid. Why there is a formation of carbonic acid? Because there is increased concentration of carbon dioxide in the blood, and this CO2 reacts with H2O, and there is a formation of carbonic acid. And why there is an increased concentration of CO2 in the blood? Because there is a less removal of CO2 from the body. And why is it so? Because this morphine directly depresses the respiratory center in the brainstem, and that's why there is a respiratory depression, and that is the reason why morphine is contraindicated in the head injury.